Gentleman from California is recognized.
Mr. Speaker, I yield myself 2 minutes.
Gentleman is recognized.
I rise today in opposition to the Patients Rights Repeal Act, because what the Republicans will do is take away all the benefits the American people are already seeing under this law, and they will stop the full implementation of it to provide millions of people with health insurance opportunities. Our Republican colleagues say they want to provide access to health care. They want to do something about people with pre-existing conditions. They say they care about stopping discriminatory practices. They want to lower the deficit. They want to stop rising health care costs. This bill, the Affordable Care Act, is the one piece of legislation that takes major steps on these issues. The Republicans offer nothing but opposition over and over again. This is the 37th time the House will vote to repeal the Patients' Rights Bill. From the very beginning, the Republicans opposed it. They said it will kill jobs, and they were wrong. They said the law would drive up health care costs through the roof. They were wrong. We're seeing the slowest growth in health care spending in decades. They've ignored the significant benefits that are helping tens of millions of people, such as 3 million young adults who have coverage through their parents' plans, 6 million seniors who have saved over $6 billion on their prescription drugs, 13 million Americans who have received over $1 billion in rebates from their insurers, over 100 million Americans who have access to free preventive care, who no longer face lifetime limits on their coverage. And the Congressional Budget Office still confirms that the law cuts the deficit by $100 billion in the first decade and more than $1 trillion in the second. The Republican Patients' Rights Repeal Act undoes all of these benefits. They add to the deficit, and they send us back to the days when insurance companies were in charge. Costs were skyrocketing, and tens of millions either had no coverage, especially if they had pre-existing conditions, or coverage they could depend on. I urge my colleagues to vote no on this legislation and reserve the balance of our time.
Gentleman reserves.